We're at the IAS meeting where we're with Barbara Felber. She's with the NIH, and it's the National Cancer Institute.
Correct.
And we're learning yet again that an item that's being used for cancer, IL-15, is also convergently able to work with HIV in treatment prevention, and along with other treatments that are going to maybe attack the virus in a way that will attribute to maybe a cure at some point.
Yes, we discovered the heterodimeric IL-15 cytokine, George Pavlakis and myself, that allowed us to produce this cytokine from mammalian cells, which is very important because so you can produce a cytokine in its natural form, which we have demonstrated exists. We are using this currently at the National Cancer Institute in treatment of people with metastatic cancer. And we are also using it in the macaque model currently to see what happens. And the big discovery that we made is that the treatment with IL-15 makes more of the CD8 effector cells, or more of natural killer cells to grow. Not only do you have more of them, they go to the lymph nodes, and specifically they go to the germinal centers. The germinal center is important because that's where the virus is hiding. So we envision that IL-15 treatment should be part of the ART treatment that people are ongoing, because you want to make more of the killer cells than you currently have. And if one ultimately could combine this with a T-cell vaccine that we have developed together with Jim Mullins from the University of Washington in Seattle and George Pavlakis at the NCI. So this is a vaccine that currently will go into an HVTN trial to understand immunogenicity in humans. This vaccine target is a T-cell vaccine that targets the Achilles heel of the virus. So if we can combine this and then treat with IL-15 and make more of these killer cells to go to the germinal centers, we believe we really can be even more powerful, supercharge the immune system and kill the virus. And the interleukin-15, as I said, is currently in clinical trials at the National Institute of Health, in the clinical center. And Altimmune Therapeutics allowed us to move this into clinical trial, and Novartis has now acquired Altimmune, so the heterodimeric IL-15 is now in Novartis' hands and is there used for cancer immunotherapy. But I believe it's very important to think about what we now have discovered, what can work in cancer immunotherapy, and we have demonstrated there that cancer can shrink in the mouse model, that now spills over to HIV treatment. So it's another one of these links that combines cancer immunotherapy and HIV immunotherapy, and I think this is very important to be part of our future strategy.
Can you describe how the IL-15 actually does what it does as a cytokine?
It is a cytokine. It makes the CD8 cells, CD4 cells, NK gamma cells, gamma T cells to grow. In contrast to IL-2, that also makes the Treg cells to grow and therefore has problems. IL-15 doesn't have the problems of IL-2. It's a milder cytokine, we call it. So it makes the cells to grow, it makes that the cells have more cytotoxicity, they can kill better, and most importantly, it makes that cells can go away from the bloodstream, so you don't just accumulate in your blood cells, they can actually go out, they can go to tumors. And in the case of HIV, we find it to go to the germinal centers. We find it to go into tumors, not only in the mouse model. We happen to have a very rare macaque that had a tumor. That's something very, very rare. We've had one of those, and we treated the animal with IL-15, and we found killer cells to go to the tumor. Wow. So we believe that there are nice links and nice translations from mouse to macaques, and we hope now in the human trials for cancer, and that again that will be combined with other agents. There is no one item for everything. So go back to HIV for the cure. Obviously, we have a super ART treatment for people, but it's not good enough, as you know, because you stop taking ART and the virus comes back. So we need to have agents that help to reduce this reservoir, and that will also help that there is less evolution of antiretroviral resistant viruses.
So what are the next steps for you or Novartis?
Okay, so Novartis will test combinations, likely PD-1, that's now the thing to do, in cancer immunotherapy. We are focusing on HIV therapy and focusing on the animal model. So we're having animals that are treated with ARC like humans, and then they get IL-15 treatment. And we have demonstrated that this is not toxic. That's very important. And now the question is going to be, what is the effect really on the reservoir? We are in the middle of doing those studies, so we don't know the answer yet. But it will be along that line, maybe even in combination also with PD-1 or whatever compounds. So it's a field that is in motion. At the same time, we also can do in macaque the studies, as I pointed out before, where we can take this T-cell vaccine that we developed with Jim Mullins and George Pavlakis, that targets the focuses on highly conserved regions, the Achilles heel of the virus, and we can mimic in the macaque model this system. And when we are successful, we can do the next step and go into the clinic.
Well, it bears worth watching, and I very much appreciate you taking the time with us today.
Thank you very much.
Thank you.